What's the one piece of career advice you wish someone had given to you when you were starting out?
So, I think the one piece of career advice that is really understanding, especially when I came into the NHS, understanding the basics of how the NHS operates, and specifically around the things like the acute hospital, the mental health hospital, and the community, because I think you come into the NHS and you can very quickly be overwhelmed with all these different complexities, all these different things coming at you. But actually, in a transformation improvement or PMO role, I think it's about really making sure that you get to the core understanding of how all those things operate, because then you can better understand how you can influence and make change happen. And so that, to me, is what the career advice I wish somebody gave me. And it is the career advice I would give to anybody starting, is to really get in there and understand it. And I mean by that is not going and talking to them and mapping out a baseline, but actually going down there and setting within your urgent treatment center or one of your specialties and spending a day to really understand the nuances of what they go through, from booking patients in, receptions, to the treatment, to the follow-ons, etc. Because I think you need to understand those mechanisms to really understand how to make, like I said, how to make change happen, and then the difficulties that they face to make change happen, especially when they're in high demand. I tell people that until you really see ED, emergency department, at high demand and sit there and watch it, you can't understand actually how you can make improvements. So it's really getting down to what you would hear people in the transformation improvement world call about the Gemba, go and see, and getting to the floor and really getting to the nub of understanding. That's the career advice I would give to anybody starting out.
Can you share a pivotal moment in your career that made a significant impact?
Pivotal moment. So I think the pivotal moment for me was when I started in the NHS, started working in integrated care systems. I think the pivotal moment was when I stepped into working for an acute trust and once again, seeing it on, right in front of you, how things are and how they operate and the struggles people go through. And the pivotal moment was actually seeing how simple changes that we made, small incremental changes that we would make, had a massive difference on staff and patients. Very, very simple things, from, talking to people that they had an issue, they were having to walk across the area to get to a microwave, and actually how could we change that, or making sure supplies were right in the right place. And those small things made significant changes in staff members' lives and daily. And that had a great impact. And it also helps you on two levels. First, understanding that the small incremental changes are very important. As you watch the NHS Impact, they focus on the small incremental changes, but also that actually it's the impact on people, and it is a people service. So the human dimensions of change and understanding that, I think that was the pivotal moment in my career. And then that's why I love working on the ground, to go and see and working with the people on the ground doing the actual stuff, versus setting up at a higher level at an integrated care system and actually probably losing that on the ground understanding.
How do you approach challenges and setbacks in your professional life, and what's your go-to strategy for overcoming them?
So for challenges and setbacks, I look at them as opportunities, both one as a learning opportunity, and I use something, appreciative inquiry, to try to how I focus. So I look at, okay, what did I do well? What was the thing that we did really well, really good with that? What can I improve on? And what are those key lessons that I've learned from that, and uses that as that place where you can get some real understanding of how do you do better in the future. So my go-to strategy is to really focus on those things that, once again, that I can do well, that people say that went really well. You did that really well. The way we facilitated the improvement workshop and the way we got to the nub of the problem went really well. And then what are the things that I can improve on that will not make it a challenge or a setback, and how to do that. And my go-to strategy as well is to make sure you have a real deep plan, and focus on making sure you have a step-by-step plan and a process to follow, and then come back to it and improve it, but to continually and update it, but to continually have a plan and continually focus on that plan. And I think if people do that, I think that's really good. I think we focus a lot in the NHS on the problem and the negative of the problem versus actually, what are we doing well? Actually, what do we do good? Okay, let's park that here. That's really good. And then instead of looking at it as a challenge, where can we improve, or what is our opportunities for improvement, and how do we come together to do that? So that's how I focus on it as well. And I think it works. It works for me, and it's worked out throughout my career, and it's worked really well.